It's Anonymous MD with Dr. T.
And Lisa.
Dr. T brings the real and refreshing insights, straightforward, evidence-based, and up-to-date. Now here's the doctor and Lisa.
All right, we're back. Second episode of the week. Hey, Lise, how are you?
Hey, Dr. T. I'm great, thanks.
Yeah, we're...
I'm excited about our guest today.
I am super excited. We have Dr. Urva Naik, and she's a huge Toronto Raptors fan. So we, just wanted to highlight that they are the reigning champs in the NBA. And Dr. Urva Naik works out of Ascension Providence Hospital in Detroit, Michigan, and she's been practicing since 2016. And I thought, you know what? Let's start today's episode by talking about that Toronto Raptors championship run that we were both very passionate about. What did you see from Detroit? Because I know you were going to the Palace a lot to go watch them play. What did you see over the last 6-7 years as the team developed to become a championship team?
Over here, we had a pretty big Canadian fan base in general. I lived in Detroit for my training, and then I moved back to Windsor for a little bit as my visa was getting processed. And so I got to kind of see it from both ends. And it seemed like the town was a little bit more cognizant of who the Raptors actually were. But going to Windsor was awesome because I could actually feel the energy and the spirit of having the Raptors in the finals. And we had our little Jurassic Park in Windsor for the championships. And, you just see the flags everywhere and the shirts everywhere. And it was, even though I couldn't be in Toronto at the time, it was still a pretty fantastic atmosphere. And we were all really excited.
Yeah, I'm pretty sure you can see each other's coastlines if you look across the lake. And what lake is that? Is that Lake Michigan, I assume, or am I getting my geography wrong?
Lake Michigan is on the west side of the state.
Got it.
So
Okay.
Lake Michigan is between Detroit and Chicago. So on the east side of the state, it's Lake Erie. So it's actually the Detroit River that connects.
That's embarrassing that I didn't know that. But
okay.
I just haven't looked at a map in a while.
I moved here. I really didn't know much of this area. So, but yeah, it's very, very, you can see, you could literally see your friend across the river if they're standing in the right spot because it's very narrow, the river. And
it must have been nice to have that Jurassic Park too.
Yeah, absolutely.
Yeah, no, that's awesome.
A little piece of home, which is why
it's a nice reminder to remember that communal energy. I was in Nathan Phillips Square for the parade day, mostly because I love being in crowds with good energy. So that's I just got a little goosebump tingles remembering that feeling of all that good energy coming off of people that I'm really missing right now. So
yeah, absolutely.
It was a great year.
Yeah, it was a great year, and it's a good thing we got it done in 2019 because we've seen kind of what's happened in 2020, and that's what's kind of brought Lisa and I together to do this podcast and talk about COVID-19 and how it's affecting our society. And we've wanted to interview people from all different walks of lives and experiences and kind of get their view on what's going on. So to hear from an obstetrician, what we they generally call an OB, I think is awesome for our listeners today. So thank you for joining us. We really appreciate it.
Absolutely. Thank you so much for having me.
Mm-hmm. So I think that, we have their pregnancies are still happening. Babies are still being born, right? Life goes on even through a pandemic. So I guess, what have you been advising your patients during this time? During COVID, because the questions are different, right? But you've had a few months of practice now, so I'm sure.
Absolutely. I kind of break it down into the prenatal care, the hospital care at the time of delivery, and then the postpartum care. So in terms of the prenatal care, things directly related to the virus, there's still a lot of information that's coming out from different countries. Lots of studies that are being done outside of the US, within Canada, Europe, Asia, a lot of places that have been affected. Nothing that's been giving us extremely firm guidelines, but more so patterns and things that we're seeing. And so this is what we're using to guide our patients. And, it is constantly evolving and we're trying to stay on top of it. But the things that we do know so far is if a mother gets infected with COVID, she cannot pass it to her baby.
Got it.
So,
Oh,
So we're
what an
talking
amazing
about
thing
that.
that is to
That's
know.
something called vertical transmission. That's a term we use, vertical transmission. So some
correct.
diseases you can pass from mother to baby, and other
Mm-hmm.
conditions you can't. So that's a big piece of information that I think is very good in this case.
Yeah,
That's very good. And this is based on all of the data we have so far, right?
correct.
It's showing. Okay, that's
They're not
wonderful.
huge studies. In
No.
medicine, our ideal studies are things that are called randomized controlled trials, which are basically blinded studies where we can control a lot of the variables and see how things are really affecting um, patients and the things we want to look at. So these aren't those types of studies, and we may never be able to get these types of studies because they're difficult to do in pregnancy and with pregnant women. But from the observations that we've seen, like Dr. T said, this is not something that we're noticing. So there, right now, we can say there is no vertical transmission.
Yeah, and when we've talked a lot about evidence-based medicine and randomized controlled trials on this podcast, and it's extremely important for our listeners to understand that our medical community really tries to adhere to the scientific method as much as we can to try and answer our clinical questions. But when we're talking about harm, when we have what are called prospective studies, where you can kind of see cases continue to accumulate and track whether babies are testing positive or not, you can tell quite early about harm, as opposed to whether something's working or not. A medication would have to go through a randomized controlled trial, but I think that's very good news, and I think it sounds like we're hopeful that we will not see vertical transmission at any time in the future.
Correct. So that's something that hopefully will alleviate a lot of moms' minds. The other part that I'm also telling patients is that as a population, they are not more likely to get the virus compared to somebody who is not pregnant.
Right.
Meaning there's nothing special or nothing different that changes when they become pregnant that makes them more likely to get the virus compared to somebody who is of equal age, equal race, everything else equal, but they're not pregnant.
Right.
Um,
So the same.
That's great, because I feel like pregnant women sometimes feel like they might be more vulnerable to certain things that they want to really protect their baby.
right.
And but so great to be able to reassure, because in this scenario they are not more likely to contract COVID.
Right. The factor, however, that we do warn women about, and this is more so going based on how other viruses act in pregnancy, the most common example being the flu virus, the way that a pregnant mother's body changes in terms of how her lungs work and her heart works with pregnancy, she is slightly more likely to develop complications from the virus if she were to get it in the first place. So
Right.
again, the chance for contracting the virus to begin with is low.
Right.
However, if she were to get the virus, there is a chance she could have more severe complications compared to somebody who is not pregnant.
Yeah. So we've kind of alluded to how a couple of the risk factors for more serious disease are obesity and frailty and mobility. And obviously, when you're in your third trimester pregnancy, this is a medical condition, and it's a beautiful miracle. But at the same time, the bodies definitely change. I don't think we need to get into the details of how they change, but the heart starts to function differently. The blood content is a little bit more diluted, and the lungs don't have as much capacity to expand. Are those kind of the things that you're referring to?
Correct. And in general, we also consider pregnancy to be what we call an immunosuppressed state, meaning where your immune system is a little bit pushed down, so that it's our body's natural instinct to fight things that are foreign to us, and we don't want the body to think that the baby is something foreign. So when you're pregnant, your body does naturally suppress its immune system slightly so that your body doesn't start attacking the baby. But this also makes the mom a little bit more likely to develop complications from the virus.
Right. So they don't have an increased risk of getting the virus, but if they get the virus, we need to be a little bit more precautious and diligent in terms of caring for this patient population. So the same types of cautions that are being advised for the general population would suffice for our pregnant patient. Is that fair to say?
That is fair. Even if they can be a little bit more strict, double kind of think twice about, do they really need to be the ones going to the grocery store?
Right.
Is it really important to um, go to that, now as things may start to lift a little bit. I know that they're being a lot more stricter in Ontario compared to Michigan, which is nice to see. But just kind of thinking twice about day-to-day activities and, whether it's something you absolutely really need to do or if it's something that can wait.
It's really good advice, I think, is just not to panic, but to make smart decisions, right? That's all we can all do. So that's excellent advice.
So what else do we know when we talk about, the prenatal and then the hospital experience? I'm curious to know about the hospital experience because, it used to be where you just had the family and they could come into the hospital right away and visit the newborn and hug the newborn, and so how's that process being affected by COVID-19?
So it has become a little bit more, and I don't like to use this word, but it seems to be appropriate in this case, more of a sterile process in
Right.
the sense that we are doing everything we can to limit exposure to not only the healthcare providers, but also the mom and the newborn baby. And so a lot of hospitals that patients may go to now will have very restricted visitor policies. So now instead of your mom and your sister and your mother-in-law and your best friend and your husband coming with you to the delivery, a lot of hospitals are restricting it to just one support person. And that is not a decision that was made lightly. Obviously, we understand that this is something that women do need a lot of support for and need that village for from the very beginning. But this was a decision made basically in the name of safety and to keep the pregnant mom, excuse me, the newborn and the healthcare workers safe, to limit the people on labor and delivery. So that is one thing that is very different.
I know it depends per hospital, probably, and it's very regional as well, I imagine. But I know that some have time limits on how long a partner or whomever it is that you choose to have with you in delivery can stay. Are there any things like that you have in place?
Yeah, so at our hospital we are allowing one support person, um, and they can't kind of come and go and come and go. They have to stay with the mother in the room the whole time, but we are allowing one person in the room. I've had friends whose siblings have delivered it at hospitals in Ontario, and it was like you're mentioning, Lisa, that it is very strict with the time limits. So he was able to be with his wife right before their C-section, during the course of the C-section, and then for a couple of hours after, and then he had to leave. I think they expedited the mom's discharge so that she could get home quicker and be with her family. However, I know that they're being quite strict in some hospitals as well. So it's always a good question to ask your OBGYN, and they'll be able to tell you exactly what the policy is at the hospital you're delivering at. So
Absolutely. You want to mentally prepare yourself as much as possible, I would imagine, because everything else about the childbirth is fairly, unknown until it's happening, right? So at least there, how much support you can have, and if you're going to be solo for a little while, which I would think is very difficult.
And again, to reassure, I mean, this obviously does not replace having a loved one there, but do know that the nurses on labor and delivery, the physicians, the support team there knows exactly how much that family is needed, and will do everything they can to sort of recreate that for them. But
I don't doubt that at all. That's so lovely.
Well, and I want to emphasize that message out to any providers in general who are listening to our podcast, that we're all going through something really new together, and we're thinking on the fly and executing on the fly, and we just need to stay patient, empathetic, supportive. We need to go the extra mile, especially with all the other things going on around us as well. And it's almost extra important that you have an obstetrician who is and their team of wonderful nurses who play a big role in and midwives who play a big role in the delivery of babies, for them to understand what their patients need in terms of support goes a long way in just kind of defining the first moments of the time a mother has with their baby. So that I'm glad that you guys brought that up and really emphasized that.
Now, in terms, I guess the next step would be speaking about postpartum.
Mm-hmm.
And what that care is like once somebody goes home. Are you seeing anything really different there? Is there any advice to
So
give?
postpartum, it's really more just restricting visitors is what we're advising, and this is sort of advice that we're giving in line with the pediatricians as well. Again, this is more to protect mom and baby, because baby freshly born, again, the baby's immune system is not going to be quite up to where it needs to be. So we are advising that, you try to limit visitors as much as you can. Obviously, a new baby does require help, and we understand that. So we ask, if possible, possibly to have whoever's going to be helping you try to quarantine themselves for a couple weeks right before delivery, so that there's been minimal exposure. And then, the biggest thing I tell my patients is, don't worry about offending anybody. Don't worry about, making people feel bad, or
Good
making
point.
people feel like, oh, well, they're not letting me see the baby or my grandkid or my niece or nephew, because at the end of the day, this is not about them.
Right.
This is about you and your baby, and you need to do what you're comfortable with, and no one should make you feel guilty. We thankfully live in 2020, where there's plenty of ways for us to communicate.
Yeah, it's that baby smell. That's it. That's why people are angry, and I get it. I totally understand it. I'm missing it myself.
There is
I'm used to
something
being around a few,
special
but
about
that's
how
okay.
babies smell. There is
Yeah,
really something special
we'll
about how
get through
babies
it,
smell.
and we'll
Yeah.
smell a baby again, everybody. Don't
One
worry.
day. What's that, Irva? Say that one more time.
Like an air freshener, like a
Yeah,
little
they
new.
do.
Oh my God, Urva, let's talk about that after the show. We should make that happen.
Yeah, it's good. That's a good scent flavor.
It's a really good idea.
So the other thing, I guess, early mothers may want to know is, the newborn themselves, if they were to catch the virus, are we finding that newborns or neonatal infants, this may be, a discussion that you probably have with the pediatric team a lot, is, what are the risks to the baby, first of all? And is there any counseling involved in terms of grandparents or people that are around them that may be at higher risk? Are you having those types of discussions with your patients as well?
So you're right that this is more of discussion with the pediatrician, but we do tell patients, for moms who have tested positive, we try to limit their contact, unfortunately, as much as we can with the baby, at least for the first couple weeks. Obviously, if they're very symptomatic, meaning they have the fever, the cough, the shortness of breath, they require help in the hospital, then, the baby wouldn't be able to be with mom. But if they are one of the patients who don't have many symptoms, or what we call an asymptomatic carrier, meaning they don't have symptoms but are positive, we ask them to hand wash, wear a mask when they're around the baby, especially when they're breastfeeding. Around high risk family members like grandparents, the baby themselves, from the studies that, again, when we use the word study loosely, but from the case reports and the observations that are being seen, the babies are not at a huge risk of complications from COVID. With that being said, especially early on in this pandemic, we did hear of a couple babies pass from the virus. Sorry.
It's okay. When a doctor's phone
It's
goes
okay.
off on our show, we assume they're
It-
on call. It's just the rule.
No, it's mom.
Yeah, well, that's
Mom.
another.
Yeah,
That's
the
on
doctors
call.
are people, right?
That's
So there
right.
we go.
Mom
Yeah.
is on call as well. So
So anyway, so luckily we haven't seen too many reports of babies who are positive having serious complications from the virus. They seem to recover fairly well, and they seem to be quite robust. But with that being said, we still want to do everything we can to protect the baby.
Oh, I didn't even consider a mother giving birth and having COVID and then not being able to be around their newborn. Oh, that's a new layer of difficulty there.
Yeah, and we've unfortunately had to separate some moms and babies, and we had one patient who was on a ventilator for about a month after delivery. She had a C-section immediately when she started going downhill. We delivered the baby, and then she was on a ventilator for about a month, and then in the hospital for another month after recovering. But she was able to go home on Monday after almost 2 months in the hospital and see her baby for the first time, and it was very special. So
Oh my God. Congratulations to her and to you for helping her get there.
Well, and let's also remember that our OBs are surgeons, and very skilled surgeons, and they have to deliver babies in very difficult circumstances sometimes, and true heroes. some of the most compassionate and empathetic people we know in our industry, in our field of medicine. You know, having you on, Urva, was such an awesome experience, and I think the messages you helped spread to our pregnant or soon to deliver or just delivered mothers is amazing. Is you know, with everything else that's going on, is there any other just, you know, general comments you want to make about COVID-19 and kind of the shutdown that's happened and the effect it's having on your community there, near just outside of Detroit?
Yep. So it was definitely been hard, as it has been all over the world. Michigan has been in the news a lot for our protests and people wanting to reopen the state and disagreeing with their governor. But I do want to say that the majority of the state does support our governor, and I think we all understand that people are going through a hard time, not just healthcare workers, and you know, people are calling us heroes, and we're not really here to be heroes. We're just here to help and do our job. And I think everyone has really stepped up in all areas of many industries, with the grocery workers and our postal workers and our sanitation crew, and literally everybody on all walks of life has stepped up. So I think, you know, as much as we see the negatives with the shutdowns and the financial hardships, I think we always see this quote thrown around during hard times is always look for the helpers, because whenever there's something bad going on, there's always going to be helpers. So and then being on labor delivery, you kind of get to see every day that even though there's terrible things happening, life still goes on, and there's still new babies being born and new minds into this world that will hopefully make this world a better place. And it's just very much a ray of sunshine in all of this.
I got goosebumps. Did you?
Yeah, me too.
Yeah.
Like, who knows if one of those babies you deliver is going to, you know, create a vaccine for another virus in the future that will be a problem, right? Hopefully we'll have, by the time they get to university, we'll have a vaccine for this one.
Oh, we
So I'm
better,
not gonna
but
say
we
that,
better
but-
have a vaccine by then. Yeah. And it looks like we will, but I mean,
Yes.
it's very well said. I mean, you know, a lot of the discussion on here has been about the unknown and the uncertainty, and you know, people in positions of legislation and where they make decisions, they have to make decisions based on what they think is best, and nobody knows, and everybody has a different theory, and everybody has a different execution of that theory into a plan. And I think, you know, just that message of cohesiveness, and just to highlight the fact that we're still having babies born every day, it's just like such a good thing to know, you know, with everything else that's going on. And you know, my dad, who spoke to me before I went to med school, he said, you know, one of the most special moments you'll ever have is the first time you deliver a baby. And I'll never forget the first time I did deliver a baby as a med student, and then again as a resident. And I don't do that anymore. I had to do it as a family doctor, but you know, you continue to bring us the miracle of life, and so thank you.
Yes, everyone with a uterus thanks you for your specialty.
Yes, that's absolutely
you.
right. And everybody surrounding you, like you said, the people that we forget that are on the front lines with you, we thank them too.
Well, you've also been there, Dr. T, so we thank you as well.
I think
He
that's a
has,
good way.
I can attest.
I think that's a good way to end it off, guys. What do you
I
think?
think that's a beautiful way to end it off. And
is.
Urva, we'll talk in 5 minutes about this baby smell candle we're gonna market.
Yeah.
Oh my gosh. I think of a good name though.
Yeah, okay. Don't say
Don't
it yet.
tell
Okay.
anybody. Okay, guys. Well,
Okay.
Urva, it was
All
great
right.
to have you. Lisa, I'll see you next week.
Absolutely, you will.
Say bye to everybody. I say so long, and we'll see you next week.
See you soon.
Thank you.
Bye.
Thanks for listening to the show. Subscribe wherever you're listening to the podcast. On YouTube, smash that bell. That's a notification button. Anytime the doctor knows something, so will you. Stay healthy. See you next time.